we share our requests for help with recruiting?
Yes. So can you all hear me okay? My sound has been very funny today. So let me know if that changes. Um, Only really update or ask. Well, first we got all the workshops off and running last week, which was amazing. Everything that was done to lead people into that worked because they all had a good amount of people in them, which is exciting. We have a DSMP starting next week on the 22nd. So I've got 5 people on the list now. And I spent this morning going back to everyone who's inquired or been referred for it since like Thanksgiving. Um, and just followed up with all of them again today, just in case. Got a lot of no thank yous, which is better than nothing because at least it knows that someone is reading my email and answering their phone. But other than that, that's really just the focus is in the next week, getting more people into that and through the first couple weeks. So definitely any, I guess, sort of what's the word I'm looking for? It's like good targets for outreach for DSMP in the next couple weeks. This will be the last one, and then we'll do another one in the next couple months. So they don't feel quite like chronic pain or the DPPs. Those feel it seems so far anyway this year, those seem to feel a bit easier. But that's really all I had. Not a ton. Other than that, I know we're working on getting other workshops on the schedule, and the February DPPs have had interest and enrollments, so those will get going as well.
Caitlin, I wonder if when we've got a DSMP starting, it feels like, I mean, so many people have diabetes. I feel like there should be like, a few more key areas sort of target those. And since they don't pop up all that frequently, I wonder if we should reach out to, I think it's Kate Meyerson, who is currently in charge of the listserv for the Diabetes Association of, oh
Mm.
gosh, they call them so, the Association of Certified Diabetes Care and Education Specialists. Um, and just so that she can give a heads up to all those people that might have clients who it would just be a simple email, maybe with a standard blurb that, hi everyone, new workshop start for diabetes self-management starting on this date, spread the word.
I love that idea. I think it's a nice way to get to folks. And I think it's a nice way to get to, a lot of times I think with diabetes, self-management in conversation anyway. So very anecdotally, sometimes it doesn't feel like the best time for folks, especially if they're newly diagnosed, because they feel like they're still getting a lot of other stuff sorted. So we kind of come in sometimes bundled at the very beginning, it seems for folks, and that's a good thing and it works and people join workshops and it's impactful. But I wonder too if by contacting, as you said, through Kate Meyerson, that group of people again, it can also like remind people to make those referrals again, because sometimes it's a question of timing.
Mhm. Yeah, and I don't know how many of them keep us at the top of their brain. It always amazes me every time like we like present or share or something at one of those conferences. Like there's always a handful of people that are surprised that we exist. If you want to
And
send
they're
me the
always like, "Oh
workshop,
my gosh, that's so amazing!"
yeah, and you're like, yeah, it's been amazing for like 15 years now. And, like,
They're like, it's
um,
free? Did you say it's free? I'm like,
yes, yes, it's free. There's no catch. You have to attend. That's the catch if you want the benefit. But if you want to send me those workshop details, Caitlin, I can start by putting together like an initial email for Kate and copy you on it just to like make that introduction.
yeah, that'd be great.
And then next time one crops up, we can, depending, she might be like, no, this isn't an appropriate venue. No, thank you. But she might also say, if it's not, she might say, but here's an idea. We have a newsletter. Or
I do just want to do a shout out that I sent it to all my diabetes educators in Rutland and Bennington County. I don't know if anyone ever bites on them, but I do share. I know in Rutland County it's hard because they have a support group, and I feel here because it's in person and the support group has actually grown quite a bit because they just go in without like a curriculum and they just talk and ask the educators. Hmm.
I don't know if they have this too. I know that, so I just happened to be like, TMI, but like waiting in line for my mammogram the other day. And they had like, in the little waiting room, they have the screens, right? We've talked about the screens before. Where they're like, oh, here's this equity thing that we're doing, and here's this activity that's happening. And I don't know if they do that in at CVMC too, Vicky, but I know that the UVMMC does. And so maybe that's a project for Amy or Vicky, or I don't know. I'm sure, I assume there's screens everywhere. It's just a matter of like tracking down like who's in charge of the screens. I have no idea like who would be in charge of the screens, but that might be another one.
Right.
I don't know how much traction it gets because it has to be right place, right time. But
Right. I do know they have those screens in the mammogram waiting area, because there's nothing else to look at, right? I think the tricky part is like finding who's in charge of those and convincing them that we're not asking for free advertising for something that's not health system related.
Yeah.
I know the health system is very cautious and careful about what they promote and promoting only their things. So we need to
it's
remind them that this is their thing.
Yeah. And we're giving you money to make this your thing. I know that our money is a drop in the bucket, but
I will say though that I have had some people that have joined the diabetes workshop before who are, I remember this one gentleman was newly diagnosed and he and his wife were so panicked. They drove from Burlington to attend an in-person workshop, I think, because they just wanted information. They were newly diagnosed. They were spinning, everything, their heads were spinning and they were like, oh my gosh, this is so good.
people will go to great
Oh.
lengths. We want to make it so they don't have to go to great lengths, but yeah, if you need something, you need something.
We lost Melissa.
Maybe she was trying to raise her hand, like left instead.
I think it's interesting, Vicky, to your point, just talking to people, the way the workshop like draws people who have been newly diagnosed and people who've been living with it for a long time and like the full spectrum of experiences. And I think about how like you would know firsthand how interesting it must be in that group to hear those perspectives sort of collide in that way. I always think like when I am putting together a roster now, I'm like, wow, these people are gonna like be able to learn a lot from each other and it'll be great when they can share that. So yeah.
It's just dropped me. No warning, no like spotty connection or just gone. But I was gonna say I appreciate the conversation because we've gotten a lot of traction lately from the NVRH newsletter that goes out. And so they had just reached out and said they're working on their next newsletter, which goes out in April. And do we want to put anything in there about that? So yes, we absolutely do. But I was thinking about this conversation and also that email and like, oh, what else is there sort of like out in the world that we can be making sure that we're still, referenced in or a part of. So I know, Joe, down in your area, there was someone that was doing a flyer when we met and talked with the communication folks. They do that like almost like a booklet newsletter kind of thing. So if there's anything in there, just making sure that we're still in there is
The sad thing is they never responded back to my email last quarter. I reached out, they haven't responded, so then I'm thinking probably people have changed. Anyway, it's on my list to follow up. But yeah, I love that booklet. Thank you.
Yeah, I mean, it's just the same as MDRH. It's just like a wealth of information. I'm sure people that get it look forward to getting it. Okay. And then really quickly, Vicki, because I saw you and it reminded me, yesterday Dana got back to me that they have reinstated that QR code. So they were able, I mean, give it a try, let me know, but they think that that now works. So I think you should be all set for that. Oh, you're muted. Okay. Bye, Rebecca. Thank you when you head out. So then the other thing that I wanted to just kind of touch base on was I sent out all the grant guidance last Friday. And in the grant guidance, it popped up that you all have to submit this increase in role. Oh, yeah, it works. Okay, I'll let Dana know. You all have to submit this increase enrollment plan. And so I met with Nicole for a monthly check-in yesterday. I know she's not here right now, but she had said that I could share, so I'm going to share. She asked sort of what the intent was for that project plan that's due. So it's deliverable 3A. You're going to submit an increase enrollment plan. But when you read it, it reads like, and it was intended to, that it's kind of like a group effort. So last year, everyone was supposed to increase their enrollment regionally by 10%. This year, we're just looking for across the state, across the board, increase enrollment by 10%. And the thought was that we together would identify some areas that are sort of low hanging fruit and then figure out how each of our specific new roles might benefit or might contribute to increasing enrollment in those areas. So Nicole's example as someone who's now working on social media was, let's say we pick White River Junction as an example. She doesn't serve White River Junction. She might be hard pressed to figure out how to help increase enrollment in White River Junction. But thinking about it from her new specialist role, and part of that being social media, she could start connecting with businesses and practices and providers in White River Junction, trying to like them from our Facebook page, have them like us back from their Facebook page, and kind of like use the social media to grow just awareness of the program in that area. So that was, in my mind, such a perfect way to encapsulate what I had been thinking about, which was it's sort of like a group project, but we're all going to take our own individual little pieces of it, and they might look different, and that's okay. But I wanted to just touch base because two things. One, I wanted to see if anybody had any other questions about that, or if you all have sort of like an idea going forward. And then two, do we want to look at the list of areas in the state again and just pick some that we think would be good to focus on? I know we talked about this back in November, but I don't think we kind of said like, these are the 3 areas we're going to focus on this year, or these are the 4 areas.
I'm gonna throw out the
Or whatever. So
sorry,
just want to open it up and see if any thoughts or questions.
I was just gonna jump in because I'm about to hop off. So, but I just will put a plug in for the survey feedback that we got back from the PDA survey that was done late last year, early this year. Sorry, grant year, not calendar year. That over and over and over again, we saw Northeast Kingdom, Northeast Kingdom, Northeast Kingdom, Northeast Kingdom. So I will just, if we're thinking of a handful of targeted areas, I know that that's a more challenging area, but I think it's also a uniquely connected area in some other ways. So I just wanted to put out that we got that feedback loud and clear in those survey responses, and then I will jump off and thank you all for 15 minutes of fun.
Thanks, Rebecca. So any thoughts from everybody else about, how you're going to approach that, or how, if we want to pick areas, or?
I'm wondering, I thought I understood what that was asking for before, like when we talked about it in our meeting. If you say it was November, then it's probably November. I don't remember when. We were looking at those underserved areas, and Joanne, I know you and I had multiple conversations and strategies about, and I know you may have just used White River as an example. I know historically that's been a thorn, but like Joe and I have worked together to kind of make a plan, of me targeting the VA specifically down there. And Joe, you were going to kind of cover all the surrounding environs, if I remember correctly, right? So we had our plan for that area.
Mhm.
But now I'm curious if, I don't know what other areas people are looking, what other 4 areas in the state people were looking for. And I don't know, or 3 areas or however many, or now I'm confused about whether we're just using our role as a specialty or if we're making a targeted plan for specifics like Joe and I did. Now I'm confused. I thought I understood.
No, that's fair. I think it is confusing, and I think that that's why I wanted to talk through it, because it sounds like what you come up with is fine. So like if that's your plan and you've got it in place, I think that's fine. I don't necessarily care if it's easier for you all to come up with your own individual plan like that or not. It was just that because we're trying to make this more of a statewide coverage for each of your roles, or most of them, rules, it didn't make sense anymore to say like, if you in your area need to increase the enrollment by 10%, right? Or Joe, you in your area, because we're trying to look at this more like just as the state, and as what we're doing to serve the state. So when I originally thought about this and I originally talked about it, it was like, let's figure out what we as a state can do. Let's find those low-hanging fruit areas, let's do whatever, and then figure out how we can each play into it. As it's worked out, that might be more difficult than I envisioned, that might be harder. So if it is really like within your area, you're gonna find the areas that you can serve or whatnot, that's fine. I like the approach of the VA. I think that fits perfectly in with my original idea because VA serves people from all over this.
Hmm.
Melissa, I
I
think you
lost her.
froze on us, but they do serve
Yeah.
everyone all over the state. So I kind of get where that is a good fit.
So I think that's a perfect example, Vicki, of what I was envisioning because it is something within your catchment area that serves the whole state, right? So it's a way that we can work on increasing enrollment throughout the state by highlighting something in your area. So I think I think that plan makes total sense. I don't think that we need to change anything if that's the plan you've worked on. I really just wanted to use this time today to make sure that everybody has what they need to fill that deliverable to get their plan done. I don't know, Jen, Joe, any thoughts, any questions?
I just think it's a little complicated right now with not having sort of that position at North Country Hospital to do outreach for the Northeast Kingdom. And we certainly don't want to lose that piece. And if and if we receive feedback that that needs to be a focus, then I know we've talked, Melissa and I have talked a little bit about some strategies. For example, if there's a local leader leading a workshop, perhaps using that to push out some provider outreach letters through our EMR. Because I've shared with Melissa that over the past year with our EMR transition, that hasn't been a high priority, but I feel that we are at a place within our EMR where we can begin doing that work, but it's strategizing around, which workshops, how many workshops do we want to push out? So that was one thought. If there was a local leader leading a workshop, that we could push that out through our EMR. But until we sort of know how we're going to work around this vacancy, I think that that's something that that Northern Counties is certainly open to seeing how we might be able to support those efforts.
Yeah, I think that's another perfect example of a plan because you think about the full coverage area, not just like say your specific, practices. I think Joe, you and I talked this morning about your plan, which was really just to get to know you now serve all of Southern Vermont. So you're gonna get to know all of Southern Vermont. You're gonna get to meet those folks, talking with Meredith about her plan to get like the blueprint program managers on board to support you. So I think Nicole's got a plan. I can check in with Amy. I don't know what Amy's doing or if she has a plan, but it sounds like everybody kind of has been able to take this idea and run with it. So nobody is sitting here frantically worried about what they're going to do for that deliverable. Am I understanding that correctly?
Yes, now that I know I'm not totally off track, because I did have a moment of panic.
No, and I feel, Vicky, yeah, thank you. You do the VA. I just talked to Neva because she's helping me with this workplace thing that I'm doing now. And we're still gonna walk the streets of White River Junction, I think next quarter, just to make sure everyone has, posters and stuff up.
Yeah, and you have the library connection there already anyway. But I kind of think of like the VA is kind of like a fortress on a hill, right? It's like its own separate entity.
It is. I might have someone who can get us in, Vicky, so give me another
cool.
day or two.
More than
And,
happy.
No
I've
promises.
sent out a couple of emails to some people, some contacts that one of my PHSO team members used to work at the VA a long time ago, so she gave me a couple leads, but I could always use more.
I'll see what I can find.
Short of sending my husband with information or taking a day to go like piggyback specifically to his provider on his appointment.
I think that's a perfectly good ask. Thank you, hubby. Thank you.
Well, if you guys can't get in with the contacts that you have, let me know, because I'm sure someone within the state system also has a contact that we can, you know, try to track down and tap into, or at least get a warm handoff kind of thing.
Yeah, thank you. I tend to leverage as many personal relationships as I can. I think my providers are all sick of hearing me.
I tell every doctor I see about our programming too, just like, hi, I'm here about this, but also, did you know?
Well, I mean, it's like, oh, I have a meeting with my provider. I have a meeting with rheumatology. I have a meeting with this specialist or that specialist. Perfect.
Okay. That sounds good. Thank you for just letting me sort of talk through it, think through it, make sure that you have what you need to go forward. I'm sorry about my internet connection. It is bright and sunny. There's no excuse for this today, although we do have 3 people working from home today, so that might be my bandwidth issue. Anything else that you want to make sure that we cover today?
I think I have a,
Sorry, John, go ahead.
no, that's okay. I have a question. When I was mailing out my follow-up library letters, I really just did the 72 libraries in my 4 counties. But I did send one to the Colby Library up in Lindenville because I just love that library. But now I'm thinking maybe I should send one to all the libraries so they know that. I mean, I'm sure anyway, I got my shingles shot today. It's kicking my ass. I have a long day. My mind is really gone now. But anyway, I'm thinking I should probably do more reach up follow-up from the library project. That was just my thought. It could have been
Well,
a
Joe, if you want to
timeless thought.
send me your letter, I can send it to my library contacts in Central Vermont.
Oh, that would be super. Okay, thank you.
Joe, maybe send it to everybody and ask people to forward it to their local libraries, because like,
Oh,
you know,
ding, ding,
Nicole
ding.
just sent out that one, here's a Front Porch Forum post or something, so you didn't have to create it, and then you just went and posted it. Maybe along those same lines, you've already created the content. If you send it to everyone else, maybe then we can all send it out to our local contacts.
Awesome.
Yeah,
Good
happy
idea.
to.
Thank you.
I will say, creating the content is always the part that's like, oh, I gotta write this letter. If someone already writes it, I'm happy to share it.
Although my Front Porch Forum, I was very sad. I don't think I get a lot of people in my little Front Porch Forum world. How can we expand that? Like, anyway, that's
curious
another
about
thought.
that, Caitlin, because I know, was it a couple of weeks ago, we all did sort of a push through Front Porch
Mhm.
Forum. Did you receive any?
Yeah,
Okay.
absolutely. Yeah, it's not, I was thinking about that today. Like, there's certain things that trigger various little rushes almost. And like the NVRH newsletter mailing was one of them. The My Healthy Vermont newsletter, the email was one of them. Definitely Front Porch Forum, there was a bump. And the thing with Front Porch Forum too is people kind of keep coming because if it's like back in their inbox for some reason. And that's not a bad thing. So I think that with that one, it's just good to know that it does a little bit. Like every little bit really does add up, which is exciting to see. Yeah.
So just to check, Caitlin, all the current workshops are pretty good for enrollment, right?
Yeah, just need to focus.
Does
Yeah,
that
everything that
include the
started already.
diabetes one that starts on the 22nd?
Yeah, that one that was what I was talking about.
That
at the
needs a little
beginning.
more, right?
Needs a little more. Needs a little more love.
Do we have a flyer for that?
I believe so. Let me look. I think that was one of the ones that Jen created before she left.
I think so.
Yeah, I know I got
And then
one
we can
somewhere.
start pushing the DPPs that start in February. Is that right?
Yeah,
Those are the next
absolutely.
ones. Okay.
They both already have at least a few, like 1 or 2 people in them, so that's good. The other interesting thing that happened was the workshop that started this past Wednesday at 5:30. Valerie Tomkowitz has so many people.
It
that-
has so many.
Yeah, Caitlin's
like-
actually had to put a cap on it.
Yeah,
We had one woman come out yesterday and say,
Poor
"Hey, can I
Val.
join that?" And we were just like, no.
And I know she was kind of like 15, that's a lot. And now there's like 18 or something.
Yeah.
Oh.
You know what, she actually did really good. I think that it was, the idea of it was a little overwhelming, but I was able to be there for her session 0 and she did great. So I think it'll be fine, but we definitely did hit a cap, which was interesting. It's the first time I think that since we've been working on this, that that's happened. So we were able to reach out to this person and say, I'm sorry that it's at its maximum. But we have these other ones starting up. So, that's, yeah, hopefully we'll be able to get this figured out where it's in such a rhythm that we can, fill up each next one sort of thing. I am just looking though for that flyer and I can send it out to, Jen and I'll just
Thank
send
you.
that to everybody. But after.
I can send
Yeah,
that
we
out to
do
the
have
community
one
health teams.
Do something.
The evening DPPs seem to be pretty not, I don't want to say easy because that feels like a terrible jinx if I'd be bringing some sort of curse upon myself. But I think the evening times just work for people. The daytimes they work for certain people, but it'll be good. Like I probably have 3 people who would already be ready to sign up for another evening one, which is exciting. But yeah, Val had some couples join together at the last minute. I was like, I can't split you up. We have to stop.
Well,
It's a
it's quite
good
a
problem
difference
to
from
have.
her other, for Val, yeah, there's like 4 left, I think, and the other one she does, so what a jump.
Yeah, and it's hard to predict when and how that will play out, right? But I mean, I doubt
find
she'll finish with
session
that
9
many,
to
but
13 is the
yeah.
magic witching hour.
Yeah, it's exciting. On to
Well,
the
it's
next
like we're
ones.
done. So thank you all for great conversation. And I will send out this flyer as soon as we get off this meeting, so that way you can help us with advertising it. It'd be fantastic. And then just always, let me know if you have any questions. Thanks, everyone. Have a great day.
And a big thanks to everyone who got that black working, because I don't want to have to order new posters. I'm kind of cheap that way.
I'll let
I
them
like your
know.
frugal.
Bye.
Bye, guys.